So good afternoon. My research is about how veterinary professionals are affected by companion animal euthanasia. So just a bit of background. So the word euthanasia derives from the Greek language and means the good death. And being able to provide euthanasia as a treatment is a powerful tool unique to the veterinary profession, especially in the UK. Bartram and Poulton in 2010 found that the veterinary profession has a suicide rate 4 times higher than the national average, with many commonly experiencing anxiety, depression, suicidal thoughts and other disorders such as compassion fatigue and occupational stress. The veterinary professionals are also more likely to have fatal suicide attempts because of their knowledge of death. And it's important to understand the impact that euthanasia has on veterinary professionals. So these are the main objectives of the study, and they were looking at the effects and the circumstances of euthanasia, the job role of the clinician, and the support available to the professionals involved. So for the methods, ethical approval was granted by Hartpury University's Ethics Committee, and the study used qualitative interviews followed by a scenario-based discussion. 3 registered veterinary nurses and 3 veterinary surgeons were recruited through veterinary practice contacts and then through snowball sampling. And the interviews were recorded on Microsoft Teams, and then the transcripts were analysed using Braun and Clark's 6-step inductive method. And then the data was later presented in a thematic diagram, which is here. And the overarching theme of the study is the impact of euthanasia, and over the next slides I'll be discussing the themes and the codes. So the first theme was patient well-being. So participants highlighted that being able to provide euthanasia was a privilege exclusive to the veterinary industry in the UK, but didn't mention other countries where human euthanasia is legal. So the exclusivity of euthanasia proves to be emotionally challenging and can cause psychological debate between wanting to preserve life and wanting to advocate for the patient's well-being. One participant pointed out that having a designated space for euthanasia allowed for the patient and the client to become more settled, but there is limitations in knowledge surrounding euthanasia preparation. So the next one was internal mental health support. So practice management do have a duty of care to the well-being of their employees and can often provide support to help them cope. Participants did argue that the support wasn't always given to them, and one in particular mentioned that management often undertake training just to tick a box. It is important to notice signs of deteriorating mental health so that it can be acted on quickly, but participants didn't agree that appropriate support was given. And participants felt that other staff members provide an invaluable support system to them, and that after euthanasia they had better understanding of the team's emotions. So the next one was external mental health support. So participants noted the presence of charities such as Vet Life and Mind Matters, however mentioned that professionals often wanted to be reached out to rather than reaching out themselves. So CPD can obviously be important to be able to understand own emotions and know how to help with the team's well-being, but participants did also mention that that should be more accessible. Having mental health support during veterinary education can help graduates feel more prepared for what they'll be exposed to, but some again argued that they didn't feel emotionally prepared during their studies, and educators often avoided talking about mental health, which made students then avoid getting mental health support. The next one was external influences. So these are things such as client finances, the client-staff relationship, and the client emotion, which have a great impact on the euthanasia experience. So euthanasia due to economic status of the client proves to be a cause of moral distress for both the client and the professional. Client emotion does remain at the forefront of the euthanasia, and Mattel suggested collaborating with counselling professionals to relieve the veterinary professional of the emotional burden and help the client be able to come to terms with their own emotions. Participants emphasised that having a relationship with the clients influences how they deal with the euthanasia, and professionals often grieve for a patient while helping a grieving client. So euthanasia can have a traumatic stress reaction. Participants found that this can often lead to avoiding euthanasia, but there are circumstances where you can't, like be in sole charge. Avery found that having knowledge of welfare and ethics can alleviate guilt, providing that personal emotions don't interfere with the experience. Professional competence often incorporates professionalism and professional skills to justify clinical reasoning and utilise your own emotions for the greater good of the client and the animal's welfare. So justified euthanasia was defined when the professional morally and ethically agreed with the circumstances and the decision making to prevent a patient from prolonged suffering. A client may not always be able to make the decision without guidance from a veterinary professional, but the veterinary professional must respect the client's freedom to choose what happens to their animal, but must make sure again that the circumstance is morally justifiable. So unjustified euthanasia was defined when the participants didn't feel like the euthanasia was in the best interests of the patient. So professionals tended to have a low tolerance for unjustified euthanasia at the start of their careers, but did slowly become accustomed to it. And participants felt that the effect of euthanasia was greater when they didn't agree with the circumstance, but understand that the animals are legal property of their owners, so the owner can request euthanasia if they want to. In this case, we have to consider non-maleficence, considering whether more harm can be done by keeping an animal alive, for example, aggressive euthanasia. So for the scenario-based discussion, the first scenario was a terminally ill patient, and the participants did unanimously decide that all other treatments were tried before euthanasia, so it was justifiable. For the behavioural euthanasia, participants argued that other options were exhausted except for rehoming, and that the client had tried to correct the behaviour before euthanizing. However, the RVNs in the study argued that this was unjustifiable because of human faults such as negligence or incorrect socialisation. And participants found that the scenario of the road traffic accident was justifiable because there was a poor prognosis without treatment, and in this case, the limited finances. However, again, found human fault through the driver of the vehicle and the owner not keeping the animal in a safe space. So, for job role, participants agreed that the responsibility of the euthanasia falls on the veterinary surgeon. So they obviously have the moral responsibility to follow their oath and proceed with the euthanasia, even if they do disagree with the reasoning. Participants found that the nurse supports the client, the animal and the surgeon through euthanasia and felt more noticed by the client during this time. And they do educate owners behind the ethical reasoning and provide a voice to the patient if they feel the welfare is being compromised. Participants, again, also noted that the non-clinical support staff were really important, although they weren't included in the study. They're often the first and the last face a client sees as they enter and leave the practice, usually the ones to deal with the conversations about finances, and are often the ones that follow up with a bereaved client. So for limitations, it was representative of a very small population, but still did allow for adequate data to be collected without being limited to numerical data. All of the participants did identify as females, so I'd like to see if there were differences in the scenario-based discussion. And I did actually know 5 out of 6 of the participants, so they may not have taken part if they didn't know me. And I was involved in the creation of the data, so possible biases from that. I would recommend using non-clinical support staff to see how the euthanasia directly affects them. Recommend looking further into patient preparation for euthanasia, like what the different preparation methods are and what's preferential and why. And recommend looking at how human and animal euthanasia does differ, but being able to compare the effects could help to see how human and animal professionals could support each other better. So in conclusion, professionals have a negative view on the effects of euthanasia, and more does need to be done in regards to mental health. Participants do believe that job role affects the response of the professional during euthanasia, and also believe that they were not properly equipped to deal with euthanasia. And greater education from the start in universities and colleges, and further education like CPD should be more accessible in regards to mental health. Obviously, clients do have a large impact on the effect of euthanasia, and monitoring of personal emotion is needed to prevent decline in mental health, and we should be more open to reaching out for support. Unjustified euthanasia did have a greater impact on the veterinary professional because of the moral and ethical challenges. And does anyone have any questions?
Hannah, thank you very much. That was a fab presentation and a really good presentation of your thematic analysis, which I particularly enjoyed. I just wondered, in your study, I know you only had 3 of each, but were there significant differences in the way that veterinary nurses responded as opposed to veterinary surgeons?
I wouldn't say that it was like a significant difference, but the vets tended to more have like a systematic approach to it and had more of a clinical head, and the nurses tended to show more support for the client and the surgeon and the animal throughout that.
Hey, thanks, great. You probably said at the start, but I'm afraid my brain was lapsing to the very start of when you collected your data, and I'm just wondering, was that where that data was collected in relation to the COVID, the pandemic?
So I actually collected my data in December last year, so it wasn't too much after COVID, but still.